Hi everyone, welcome back to another installment in the Nico the Vet Show. For the purposes of today's talk, I thought what we might tackle is kidney failure in cats. So I may use the terms kidney failure or renal failure interchangeably. They mean the same thing. So kidney, renal, it's the same thing. Now, to start off, we would probably split renal failure into two types of renal failure. We get a chronic renal failure and we get acute renal failure. So acute and chronic renal failure. Acute means it's just happened suddenly and abruptly, and usually this is sort of in the younger cats, say anything up to about 12 years old. And the most common causes for a youngish cat going into acute renal failure is some sort of toxic effect. Something you've ingested something that's been toxic and that has damaged your kidneys. The most common things that cats might ingest that would cause toxic insult to the kidneys would be lilies, so your lily flowers, lily plants. Cats can chew on lilies, chew on the leaves and the stalks. That can be toxic to them, but probably the most common mechanism is we bring cut flowers into the house, or you perhaps have lilies in the garden. The cats walk past and bump up or brush up against them. Some of the pollen falls on their coat. They groom it off because cats are fastidious creatures, and they ingest the pollen that way, which has a toxic effect. So a lot of people think it is only lily pollen. In fact, it's the entire lily plant, and some cats, like my own, for reasons I've never understood, will chew on blooming everything. So just bringing lilies into your house and cutting the stamens off and getting rid of the pollen is not a surefire way of ensuring that you don't put your cat at risk. The second most common thing is ethylene glycol, which is engine coolant, stuff we obviously put in our car engines. It's got a very, very sweet taste. So if it spills out of either directly from the car or from the bottle you've bought it in, lands on the floor in the garage perhaps, the cat will almost certainly, and your dog, will lap it up because it's sweet, and that can be very toxic to them. So these are your sort of acute renal failure cases. I suppose special mention also goes to the chinchillas and the Persians. Any other species can also be affected by what I'm about to say, but predominantly it's the chinchillas and the Persians. They can have polycystic kidneys. So cysts form in the kidneys, and these guys seem to be okay, and then suddenly become very unwell. And when we do an ultrasound scan, we can see multiple cysts in their kidneys, and that has destroyed the kidneys. So whether it's the expansion of cysts in the kidneys or whether it's some sort of toxic component, we see these acute cases usually in cats less than about 12 years old. So it comes out of nowhere. You suddenly have a sick cat. For today's talk, really, what I was going to address was the chronic renal failure. Chronic means long-term, and specifically, I would say more than 3 weeks duration, or it's been more than 3 weeks coming. And so this label, if you like, applies to your senior cats, the 12-year-old plus cat, where we see them just getting old, is the way a lot of people may describe it to me before they bring these cats in. So they say, well, I thought she was just getting old because she's eating less, her appetite is a little bit iffy, she doesn't really want, she sleeps more, she does less, she grooms less, her condition is looking not so good, she's lost some muscle, and she's lost skin tone. Now, all of those symptoms can be seen with a variety of conditions, but certainly the first thing that would flag in my head would be, how are your kidneys performing? So when you take the cat off to the vets, they're going to do some blood tests to measure exactly how the kidneys are working, and at the same time they would probably test the urine to get to measure some other parameters of renal function. So to make sense of the tests the vet would run, I would probably rewind a little bit and say, so what is it that the kidneys do? What is the function of the kidneys? So as you know, we've all got two kidneys, and to completely oversimplify it, think of them as the filters of the body whose job is to get rid of toxins. That's probably one of their primary functions. The next function for the kidneys is to make sure that we don't lose too much water in our wee, so that we don't dehydrate, so that we maintain our fluid level. So on the one hand, the filter is trying to draw all the toxins out of the body and eject them from the body in the wee, but on the other hand, the body doesn't want to sacrifice too much water in that process. So there's sort of two functions going on there. And a third function of the kidneys is they produce a chemical called erythropoietin. Effectively, they release this. It gets carried around in the circulation. When it gets to the bone marrow, it's what tells the bone marrow to make red blood cells. So in a nutshell, if you're in kidney failure, you're going to have three issues. You're not going to be able to filter out the chemicals from your body that need to be gotten rid of. You're not going to be able to produce enough blood, and you are not going to be able to hang on to fluids. So you will dehydrate very, very easily. So the way your vet diagnoses the issue is they take a blood and a urine sample. I usually like to do both. You put them through the machines, and what comes back is elevations in urea and creatinine, are the two chemicals we measure. So where do those chemicals come from? They are the breakdown products of protein. So when we eat protein in our diets, your body takes what it wants from that and uses it for the nutrition of your body and to build up your body. And then the bit it doesn't want, it will want to get rid of, and it will go to your kidneys, who will filter these products out, and you will pee them out. So when you're in kidney failure, what you're doing is you're not filtering the urea and creatinine out as efficiently as you should be. So the urea and creatinine levels are going to accumulate in your body, and we measure that as a rise in the level of those two chemicals, urea and creatinine, in your bloodstream. And the effect of those chemicals in your bloodstream is, pretty bluntly put, is toxic. So it starts to make you feel very, very unwell. So what are these, and then on top of that, so you're feeling unwell, and then on top of that, your kidneys are not recycling water, so you're dehydrating, and dehydration makes you feel pretty grotty too. You feel headachy, you feel weak, you feel lethargic, and a good way to sort of test hydration is to do what we call a skin tenting test. So you take the skin, if you look at the skin on my hand, and I pull it up like that and let it go, it should go straight back down. If you or your cat have become dehydrated and you pull that skin up and you tent it like that, as you let it down, it either goes down very, very slowly or not at all. And that gives you an idea of just how dehydrated you are. So it's a combination of urea and creatinine accumulating in your body, which gives you the toxic effect, and then the dehydration, which makes you feel terrible. So I suppose the best way to try to relate to how your cat is feeling is take the worst hangover you ever had and double it. Effectively, the reason you're feeling so hungover is the same two reasons. You've basically spent all night on on the jolly, dancing on the tables, drinking a variety of alcohols, and those effectively have poisoned you. They've had a toxic effect on your body. So that's the equivalent of the urea and creatinine accumulating. And then on top of that, though, you've peed a lot because you've drunk all the alcohol, so you've become dehydrated, and that's what makes you feel weak and wobbly and headachy and often nauseous. So that's just what your cat feels like, and that's why we use those chemicals, the urea and creatinine, to measure. It gives us a level, if you like, of the toxin in your body. What we measure on the urine is we measure the concentration of the urine. So again, the kidneys use the urine as a vehicle of getting the toxins out of your body, but at the same time they don't want to be losing any more water than they have to that way. So if you're in kidney failure, you will by definition be losing a lot more water than you should do. And the way we measure that is as your kidneys concentrate the toxins in your wee, and so they're putting toxins and all the rubbish in your wee, and they're taking all the water back, that your wee becomes more and more and more concentrated. A bit like reducing a sauce if you're preparing a meal. So you're reducing the sauce to make it sort of thicker and tastier. So what we can measure on the urine is how concentrated is the urine, and there's a scale that we use called specific gravity, and we want you to be above 1.035 level to be considered normal. If you're lower all the way down to sort of between 8 and 12, that's bad. That's what you would expect to see in kidney failure. But also the kidneys become leaky, and as they leak, a bit of the protein that circulates in your blood supply, so inside of your blood, a bit of that protein starts to leak through the kidneys, through the tubes of the kidneys that make the wee, and that you start to lose protein in your wee too. So that's bad for two reasons. Think of the protein, just to maybe over dramatize a little bit, think of it as the protein molecules as being like shards of microscopic glass. So as that is being forced through your kidneys and is filtering through the tubules into the wee, that's cutting and damaging the kidney. So that's making your kidney failure worse, because now you're doing harm to the failing kidney. But also, if you're leaking out the wee, then it's not available to your body to build up muscle and condition. Hence, you're going to be losing condition. So now your vet has made the diagnosis. What can we do for these guys? I suppose maybe let's rewind a little bit. So you do the urea and creatinine tests. What's very frustrating about these tests is the kidneys will only stop filtering out urea and creatinine from your blood supply once 75% of your kidneys has conked out. So that's 3/4 of both of your kidneys need to have conked out before the traditional urea and creatinine blood tests will pick it up. So that's a disaster, because effectively, if 3/4 and 3/4 are affected, you've only really got a half a kidney still functioning. So the frustration of these tests is we'll only identify these patients very late in the process. So fortunately, over the last few years, another test has become available called SDMA, and this is much better at picking up early kidney failure patients. This will pick up the fact that you are in chronic renal failure once about 40% of your kidneys has conked out. So it's still not great. You've still already lost 40% of your kidney function before we know where you are, but we've picked you up far earlier. Traditionally, the only way the soonest we could pick you up was to test your wee, and if your wee, like we said, was more dilute than it should be with the protein in it, that would suggest renal failure, but that would only become apparent once you've lost 66%, or about 2/3 of your kidney function. So the combination of these tests also lets us gauge just how bad you are in the renal function failure. So if your SDMA is up and nothing else is up, you've probably lost 40% of your kidneys. If your urine SG is down, you've probably lost 2/3 or 66%. But if those are both affected and your urea and creatinine is up, you're in trouble. You've lost 3/4 of your kidneys already. So what can we do about these guys? Really, we need to magic in 1 or 2 new kidneys for them. That's the only way to really fix the problem, is you need new filters. Some countries, I know that is being done, but in most countries that is not being done. It's for ethical reasons. It's been deemed quite sensibly that I think it's unfair for you to go out to the shop and buy another kidney from a cat from the pet shop and transplant their kidney into your own cat. I think that is a very shady moral ground there. So it's not something that most countries would allow their vets to do, and again, I think quite rightly so. So what can we do? So effectively, what we're doing is we're just trying to help you with the problem. We're not fixing you in the sense that we're not sort of putting a new filter in, but we're helping you with all the things we can help, and we're treating all the effects of the kidney failure. So the mainstay, the single most important thing you can do for your cat who is in kidney failure is to put them on a phosphate restricted diet. Now, you cannot get these at the pet shops or the supermarkets. These are specialist diets produced by the bigger cat food manufacturing companies, and usually retail exclusively through your vet or perhaps even on the internet. The 2 biggies that companies that I like are Hills and Royal Canin. Hills make a diet called the KD diet, stands for the kidney diet, and Royal Canin make one called the renal diet. It's not a plug here at all. I have no allegiance to any food manufacturer or any drug company, but those are definitely the ones that I find work best. I don't know if other companies make them. I just stick with those 2. Also, if your cat is a cat, and when you ask them to eat something new, they simply won't eat it. And to rewind a little bit, the Hills and the Royal Canin companies are well aware of this. So the renal failure diets that they've produced for these cats, they've paid special attention to making them very tasty and producing a variety of flavors for the cat. So if your cat doesn't like one, try the other. If you don't like that, try the other. But if they refuse all renal diets, that's very frustrating, because that is the single most important part of their dietary management, is to get them onto these renal diets. Like I say, if they simply will not eat them, and cats are masters at playing hardball on this kind of thing, then plan B is we can mix phosphate binders into their food. So basically these come in the form of powders usually that we mix into the food, and they do just what they say. So they bind onto the phosphate in your diet. So as it goes through your intestines, the phosphate binders hold onto the phosphate so that your body cannot absorb the phosphate, and that helps the kidney. How does it help the kidney? It doesn't do anything to fix the kidney. It just takes a bit of the working strain off the kidney. So to use an analogy, think of if you had a car that was heavily laden, and it was an old car and it wasn't working well anyway, and you've loaded it up and it's very heavy, and you're trying to get it up a hill, and the engine is really straining for the car to get up that hill. If you can just get rid of some of the work for that car to do, so unload some of the stuff from the car, then the car is better able to go up the hill, and it's less damaging for the car to do so because it's not straining quite so much. So the same applies to the kidneys. If we can just get rid of the phosphates in the diet, then there's less strain on the kidneys, just like your car going up the hill. And so not only can the kidneys work better, but they're being strained less. So they're working better now and better tomorrow and the next day. So that is absolutely the mainstay of managing these guys. Other things that we might have to consider is if your cat is just not eating, they just won't eat, they probably are nauseous. And what can we do about that? We can use, on the one hand, antiemetics, so drugs to take away the nausea. The most common ones we might use would be miripetant and metoclopramide, and we use them judiciously, as much or as little as we have to. So sometimes we just need to get you eating again, get rid of the nausea, go back to the hangover thing. You think to yourself, oh, I feel sick, I feel awful, but if I can eat something and just keep it down, it will settle my stomach and I'll feel better and I'll be able to keep eating from that point. So the same principle applies. If we can just use the antiemetics, so basically anti-nausea medications, and get you eating again, you will feel better and hopefully keep eating. To also help with the nausea, we can use acid blockers. So again, think when you're very hungover, your stomach's empty, the acid is pooling in your stomach, you're feeling nauseous, that acid is making you feel even worse. And so if we can block that acid production and you don't have all this acid sloshing around in your stomach, you'll also feel better. So apart from the anti-nausea medications, we would also add in acid blockers. And I think omeprazole is a human medication. It's not licensed for use in dogs, but it's really the only one which we've been able to prove actually does what we need it to do, which is to reduce the acid levels in the body. And then if that's not enough for you, then we would also add appetite stimulants. We use a human drug again. It's not licensed for use in cats, but we do use it. Called mirtazapine. We use this in varying amounts to try to stimulate the appetite, try to get these guys eating again. So once you've thrown all these drugs in, you've got the antacids, the anti-nausea drugs, and the appetite stimulants. What we also need to look at is what is their blood pressure, because if you are in kidney failure, you may have very high blood pressure. Not only does that make you feel awful, that can make matters worse for you, and you may have other unwanted complications of the high blood pressure. The most devastating one is blindness. So you can basically, your retinas will detach from the back of your eye and you'll go suddenly blind, and that's obviously a train smash, because generally we can't undo that. So even though we can then stabilize you after the event, you're likely to be blind for the rest of your life. So very disappointing. There are one or two other things. Some vets might suggest that you use lactulose, which is again a human product originally developed for constipation to try to help these renal failure patients. There's some evidence there to suggest that it is beneficial, but it's one of these sort of outlying drugs that I wouldn't necessarily reach for every time. And sometimes we may also reach for anabolic steroids. So anabolic steroids get a lot of bad press because of the abuse that performance athletes might use them to enhance their performance. The way the anabolics work is they just optimize all the protein that you're eating. So if you go back to what we were saying earlier, you eat all the protein, your body uses it to build up your muscle and your condition, and what the body doesn't want gets weed out. So if we give you anabolic steroids, hopefully we're ticking two boxes. On the one hand, we are helping you to maintain your bulk and your body condition and your muscles. So hopefully we help you keep that condition on the one hand, and on the other hand, because we're optimizing your utilization utilization of protein, there's less protein to go out through your kidneys and less harm that can be done to your ongoing harm that can be done to your kidneys. So all of these measures are just supportive measures. I normally refer to them as blue tack or press stick, depending on what country you live in. We're really just sort of cobbling and sticking everything back together. But many cats will live for many years with kidney failure, with some or combination or even all of these medications to help them feel better. And I think if it was me in kidney failure, if we accept that we all have finite lives and we're all going to die eventually, but I don't want to die before I need to, so I would say yes, if I was in kidney failure, I would want to avail myself of all these medications. And yes, people say, well, I don't want to give them stuff that doesn't fix the problem. It just covers over the problem. Well, that's fine. Again, we're all going to die. Let's just feel as well as we can before we do so. And so, provided these medications are working and they're giving me back my appetite, they're keeping my blood pressure down, I'm eating well, I'm maintaining some condition, I'm not dehydrating, then I think there's a strong argument to say, well, keep them coming. I'll have them every day. Thank you very much. But once they stop working, then it's a very different conversation. And so when we measure on the blood and the urine tests, we take the information we get from those two sets of tests, and there's a grading system developed by IRIS, I-R-I-S, which is the International Renal Interest Society, and they have come up with some parameters that when we measure these levels, depending on how high the levels are and what's going on, we would grade you as stage 1, 2, 3, or 4 renal failure. Just because you're a higher grade, for example a 2 rather than a 1, isn't necessarily catastrophic, because once we apply these management techniques, and remember the food is the single most important one, we can tip a lot of guys back just a little bit. So we're not fixing you, but we're just taking the load off the kidney, just like unloading your car going up the steep hill, and the kidneys can then work much better for much longer. So it is important to grade where you are, but fundamentally that the treatment we will apply will be the treatment you need. So if you're nauseous, get something for nausea. You've got poor appetite, give you something to help your appetite. If you've got high blood pressure, we give you the high blood pressure. But again, the mainstay is the food. So I hope that's made some sort of sense. I think, yes, we're all facing organ failure one day once we're elderly, and it doesn't have to be an immediately catastrophic process. It can be something that we live with long term. Consider, again, human beings. If we said that one of the kidney's jobs is to retain fluid, so we don't lose a lot of fluid, the reason we as human beings, as we get older, you've got to get up 2 or 3 times a night to have a wee, is because your kidneys are not recycling water efficiently. So that is a sign that your kidneys often are not working as well as they should. And that doesn't mean you're going to end up in a box tomorrow. It just means that this failure is coming and this failure is progressive. So this is the category that we talk about, your chronic renal failure or your chronic kidney disease cats. So this chronic meaning long term, and we should manage these guys. The acute cases are a different kettle of fish entirely, which I'll address under a different talk. So once again, I hope that made sense to all of you. There's a lot we can do for these guys, and in our investigations of them, we'll often figure out they may or may not have comorbidities. They may have other stuff going on at the same time, because old age issues don't often happen in isolation, and we can have 2 or 3 problems on the go at the same time. And by doing these bloods and the urine tests, we will identify all of the issues and address them. And there's a lot we can do for these guys. They're lovely creatures, and old age is not a disease. It's a stage of life. It's a phase of life, and it's a conking out phase. Yes, it is. But you could argue most of life, once you crest middle age, is a conking out process. So let's help them. Let's keep them going. And when we reach a point where the medications don't help them anymore, then let's give them a gentle and humane exit from life. And it's something where, in countries where that's legal for people, I think it's a wonderful gift that we can apply once we can no longer help you with medications and you're in distress or suffering. But thankfully, on a positive note, the object of this talk is to try and delay that point and have as much time, good time for you and your cat as possible. Thank you. Bye-bye.